Here there is a very important role of a nurse is to provide comfort to the patient. So to provide the comfort to the patient, we should prepare the patient unit is very important here. The profession will start from preparation of a patient unit. Our nursing profession should be start from the preparation of preparation of patient unit, and in this unit the important factors, external important factors which has to influencing the patient, those factors are very essential to consider to provide the comfort to the patient. In that factor, you just remember that the ventilation, lighting, room, temperature, air, bed, and some other factors are very essential to consider in the preparation of patient unit. And in the competitive exam, they may pay attention on the questionnaires in the patient unit preparation. In that, let me discuss, so what are the major points we should remember while we are preparing the patient unit. In that, first you just remember that adequate room temperature. This is very important. You just remember adequate room temperature. So in adequate room temperature, we should maintain 68 degree to 72 degree Fahrenheit. Temperature should be maintained in the patient room. Or in the Celsius, 20 to 22 degree, right? So Celsius temperature should be maintained. Here the patient room should not right? So low temperature and should not high temperature, means the room temperature atmosphere should not be chill, cold, and should not be warmth. So it will create the discomfort. So that's why to comfort the patient, the adequate room temperature should be 68 degree Fahrenheit to 72 degree Fahrenheit, or 20 to 22 degree Celsius. Right? In competitive exam, they should ask like the accurate room temperature of a patient, right? Or the comfortable room temperature for the patient. This is the question which we have to experience in the competitive exams. So then coming to the next, humidity. Humidity is very important here. The humidity is nothing but here the moisture in the air. So moisture in the air we call as a humidity. This moisture in the air, it's one of the factor which influencing the changing of internal temperature, internal body temperature while we are breathing. So a proper humidity is very important to stable the internal core temperature. To stable the core temperature, the humidity is one of the factor. So the adequate humidity should be maintained. So the adequate humidity is 40 to 60%. Adequate humidity to maintain in the patient unit or ward, right, or a client room is 40 to 60%. Coming to the ventilation. So ventilation is one of important factor. Ventilation is nothing but the amount of air, movementing, that is called as a ventilation. The amount of air movementing in the room called as a ventilation here. So the movement of air should be 15 to 45 feet per minute. Remember, the amount of air movement, that is called as a ventilation, should be 15 to 45 feet per minute. It's very important. Because of here, you just remember, evaporation of moisture from the skin should be depend the ventilation. So that's why the adequate air movement or the ventilation should be maintained 15 to 45 feet per minute or 1 to 3 miles per hour. So velocity should be maintained. So the movement or the air velocity should be 1 to 3 miles per hour or 15 to 45 feet per minute should be maintained in the ventilation. Coming to the next, adequate space between the bed is very important here. So the space between the two beds should be 6 feet. The space should be in between two beds should be 6 feet. At least 6 feet of space can be maintained between two beds. It's very important. Coming to the next here, adequate size of cot or the bed is very important here. The size of the bed which has to influence the patient comfort. So to maintain the patient comfort, the bed size is very important here. The size should be 78 inches long, 78 inches long and 38 inches wide, 38 inches wide. 28 inches height should be maintained from the floor. From the floor, 28 inches height only should be maintained, not less than, not higher than, right? So weight we maintain from the floor. So these are the some specifications in the cot. You just remember 78 inches long, 38 inches wide, 28 inches here we should maintain 28 inches of height from the floor can be maintained. In the dimension, you just remember there is a dimensional proportion 198 centimeter long, 96 centimeter wide and 71 centimeter should be that, right? So width can be maintained in the bed dimension. So the bed dimension should be 198 into 96 into 71. Here the question is what is the accurate measurement of bed? What is accurate measurement of patient bed? So accurate measurement of patient bed should be 78 inches into 38 inches into 28, right? So this is the proportion and the dimension of a patient bed. Coming to the next, while we are preparing the bed, some important point we should remember, and it helps to create the comfort to the patient. In that, the adequate size of mattress is one of the factors to consider. Adequate size of mattress should be 190 centimeter long and 90 centimeter wide. Adequate size of mattress should be 190 centimeter long and 90 centimeter wide, as it is fit to the bed. The dimension bed are also similar to this now. Here what I said, the dimension 198, right? Here just the mattress should be the 190 centimeter long and 90 centimeter wide. Then coming to the size of the pillow is one of the factor. Adequate size of the pillow should be, see, all the factors, these patient unit, all the factors are very important, and all the areas are very important to consider while preparing the patient unit. That's why not only pillow, not only the matter of mattress, and not only the matter of bed, not only the matter of all the comfort devices, each and every point is very important for the preparation of patient comfort. So adequate size pillow should be 60 centimeter long, 45 centimeter wide, 10 centimeter thick. 10 centimeter thick. Coming to the next, adequate size of sheet. Here the sheet size is very important, and the adequate size sheet should be 108 inches long, 76 inches wide. In case of centimeter, 174 centimeter long, 193 centimeter wide. 174 centimeter long, 193 centimeter wide. So this is the adequate size of sheet. Coming to the adequate size of draw sheet. Right, so as you know now, draw sheet should be placed at the middle of the bed. Middle of the bed. The draw sheet size should be 150 centimeter long and 110 centimeter wide. Draw sheet size should be 150 centimeter long and 110 centimeter wide. Right, so coming to the next, pillow cover is one of the matter here. The pillow cover size should be just longer than the pillow size. Longer than the pillow size, here pillow cover size is enough. If the pillow size is 60 centimeter as we recommended, the pillow cover size should be 65 centimeter long. The wide of a pillow is 45 centimeter. The cover should be 50 centimeter. Here the pillow cover size is 65 into 50 centimeter. 65 into 50 centimeter. So these you just remember, these the main points while we are preparing the bed. Before to prepare the bed, the size of the mattress, the size of the pillow, the size of the sheet, so the size of the draw sheet, the size of the pillow cover should be considered, and you should be remembered. In competitive exam, they may ask the question, so what exactly is the size of the draw sheet can be recommended for the preparation of the patient unit. There is the question like comprehensive, longer than the 3 lines, but there is only the matter is size of the draw sheet. So adequate size only we have to answer. So most of the fundamental of nursing questions are like a comprehensive questions. The questions are maybe right, so ask more than 3 lines. That's why you just remember that what exact point they are asking and what exactly option we should choose. Right, so coming to the next, that is called as a comfort device. Here the comfort devices is very important in the patient. Right, so what are the devices we should use for the patient comfort? And these devices again we should discuss in the positioning of the patient also. So there also some comfort devices which we have to use. Proper positioning of the patient. So these devices, if you know, we can properly, right, so place the patient on the bed and as the recommended by the doctors, we should provide a appropriate position to the patient. So that's why here what comfort devices we should use in the hospital setup to provide the comfort to the patient. Let me discuss. These devices also called as a mechanical devices. Remember that in that first device is a backrest. See, this is the backrest device. As you know that, right? So nowadays most of the beds are designed for all integration of these comfort devices. Even though we should remember that what exact comfort device we can use. See, backrest. So backrest, this is the backrest device. This backrest device should be in the different angle, like a 30 angle, 45 angle, 45 degree angle, 90 degree angle, 180 degree angle, 360 degree angle also can be maintained here. Right? So there is no 360, but just remember only 180 degree angle, up to 180 degree angle we should consider. And here just remember that there is a different level of angle can be possible in the backrest device. So what are the angles for what position we provide, that we discuss in the chapter of positioning. So here the backrest is a device which has to provide for the sitting position. Backrest device only used to comfort the sitting position. So next knee rest. So knee rest is the device. Knee rest is the device to relieve the pain, especially on the abdominal muscles and the pain beneath the knees, tendon pain beneath the knees. To relax the tendon beneath the knees, right? So tendon beneath the knees can be relaxed by the device called as a knee rest device. So here the knee rest device can be comfort the abdominal muscles, right? And it helps to relieve the pain from the abdominal muscles, especially during the operation in this area, and helps to just relieve the pain from the tendon beneath the knees. But this knee rest device is here doctors are mostly not advisable. There is a one contraindication for the knee rest device. The contraindication is nothing but here this device, if we have to allow, may chance to formation of thrombus, because of here the flow of the blood. The flow of the blood is stopping. So this flow of the blood when is struck, there is a risk to formation of the thrombus in this area. So the thrombus formation can be, right, so possible in the knee rest device, and there is a risk of pulmonary embolism also due to the blockage of the blood flow on lower extremities. There is a risk of pulmonary embolism and risk of thrombus formation. That's why knee rest device is mostly not, right, so advisable by the doctor. Okay, here the question is mainly the knee rest device is not advisable, or the risk of a knee rest device to use the patient. The risk of knee rest device to use the patient is maybe fear of thrombus formation, or maybe there is a risk of pulmonary embolism. Coming to the next device called as a footrest. See, footrest especially we should use to prevent the foot drops. Right, a foot drop can be prevented by the footrest. See, this is the footrest device, right? So here foot drop can be prevented from the footrest. For the long occupied patient, we use this footrest device. Long occupied patient. So long occupied patient, we use the footrest devices. Footrest devices are example hard pillows. This is the hard pillows, and sandbags. As you know, footboards also, right? Footboards, in next slide I will explain footboard picture. Hard pillows, sandbags, footboards. These are the some devices used in the footrest. Footrest, only the purpose of the footrest is to prevent the foot drops for the long occupied bed patient. Coming to the next comfort device is bed cradle. Bed cradle is the device here. This is the footboard. Footboard. So it is a footrest device. On this footboard, there is a cover should be maintained, right? So that is a bed cradle. So bed cradle, only we should use this device of bed cradle is in case of burns. If the patient with the burns, we should not directly use the blankets on the surface area, because of this area may be, right, so intact with the blanket and may chance to suffocate and skin irritate. That's why to prevent this we use a bed cradle. So bed cradle especially we use to prevent the suffocation and the skin irritation of the limbs, especially lower extremities. For that we use the bed cradles. So bed cradles also used during the drying plaster cast also, right? So to drying the plaster cast also we should use the bed cradle. Here the comprehensive question is, the patient is on occupied bed and the suffering with burns. So lower extremities are fully affected with the burns. What type of comfort devices is preferable in following? Or in the following, which one is true statement? Like this they should ask. True statement questions options also is a longer options. There are more than 1.5 line. So that's why just you quote that bed cradle only use in the burns case and also use in the drying plaster cast. Coming to the next device, bed blocks. As you know, nowadays there is a elevation options in the bed and even we should use to comfort the patient. Those are the bed blocks. So these are the bed blocks either to elevate the foot end or either to elevate the head end. So to raise the foot end or to raise the head end, we use bed blocks. So these bed blocks are helps to prevent the shock. If we have to elevate the foot end, right? So for the patient, they may prevent the shock condition, and in sometimes to arrest the hemorrhage also we should elevate the bed area, right? And to retain the enema, and after giving the spinal anesthesia also we have to use the device called as a bed block. So here there is a question like, to prevent the shock condition of the patient, which type of comfort device use in the following? This is the question. To prevent the shock, which type of comfort device should use in the following? So for that question there is the answer of bed blocks. And one more question, which type of comfort device can be used, right, to arrest the hemorrhage? So to arrest the hemorrhage, here the specially comfort device is bed blocks. Which type of comfort device can be used, right? So after giving the spinal anesthesia, there is a comfort device can be usable, that is bed blocks. So here one more device that is called as a sandbags. So the sandbags are the heavy weighted hard surface devices, heavy weight and hard surface device these hard surface devices especially we should use for immobilization of the parts. Sandbags are the hard surfaced heavy weight device especially to use immobilization of a particular part. So especially during the fracture condition or during the relief from the discomfort and during to prevention of foot drops, waist drops, right? And during the what exactly in some amputation condition, right? And in some especially what traction, right? During that also we use the sandbags devices. So sandbag devices especially helps to prevent the foot drops, wrist drops, and also helps to immobilization of a particular part. That you should remember, right? And coming to the next other comfort devices like air cushion. As you know, this is very common device we can use in the home applications, home purpose also, right? So these air cushions are very helpful for the weight lifting of a particular body part and helps to relieve the pressure, right? So especially these air cushions we observed, this is not a part of this explanation, but I am related matter only explaining. Air cushions especially we observed in train traveling, right? So most of the train traveling clients we observed that they should use this air cushion, right? Rings they should use to comfort the head end and foot end, right? But here coming to the patient, the matter of client, this is very important device, comfort device to take off the weight of the body and helps to relieve the pressure on the particular surface. And air cushions are contraindicating that we should not use directly with the contact of the skin because of this air cushion or mostly with the rubber goods only, right? So rubber goods may irritate the skin and there is a chance of bad sores. That's why air cushion should not use directly. So in the competitive exam, they should ask the question like to use of air cushion, what is contraindication? What is the contraindication? So the contraindication while to use the air cushion is should not use directly to contact with the skin. And here this air cushion mostly made up of with the rubber goods only, right? So that's why we should not interact directly with the skin. And coming to the next device that is called as a rubber and cotton rings. Rubber and cotton rings, mostly rubber and cotton rings we should use in the prominences. As you know, the prominency means which the bone is eject out. The bone prominency, as you know now, this bone prominencies can be covered by the device called as a rubber or cotton rings. See, especially this rubber and the cotton rings devices, we should use the bony prominency areas like elbow, heels, right? And here, what exactly ankles also, right? A foot ankle also, one of the hilly areas. So where the hilly areas is there, in the hilly areas, projected areas, we should use rubber and the cotton ring comfort device. Cotton ring comfort device. Right here, then coming to the next, remember that next comfort device that is called as a air and water mattress. Next comfort device called as a air and water mattress. See, this air and water mattress especially we should use in thin or very obese areas. Thin or very obese areas, because of here to prevent the close intact of surface area. to prevent the close intact of surface area, we should use these type of comfort devices. For example, there is a very thin surface area between the body part and the mattress, so there is no allowing of the air, so that may suffocate and to chance to for the ulcer, decubited ulcer or bed ulcer. So to prevent that, we use air and water mattress. So it helps to protect from the bed source or pressure source. Bed source or pressure source. So this water and the air mattress also we observed in the travelers, right? So most of the travelers, they should use this air and water mattress.